We are all in denial about our risk factors for heart disease. Each year, about 250 potential years of life are lost in Canada alone due to cardiovascular diseases, including heart attacks and other chronic heart-related conditions. 9 out of 10 Canadians are jeopardizing the quality and length of their lives. In an ideal world, time would be spent screening everybody for heart disease, but sadly, a recent poll conducted by the Canadian Heart and Stroke Foundation found that 50% of Canadians hadn't even asked by their doctor about their diet, family history of heart disease or stroke, weight, level of physical activity, or even whether they smoked. It's quite surprising, and yet there's an irrefutable connection between genes, diet, exercise, and heart disease. To begin taking charge of your heart health, there are 3 crucial measurements that I want you to track and optimize, and do this routinely with your family doctor. Being aware of them and striving to adjust them to optimal levels will have you living longer and keeping a healthier heart for life. Number 1, blood pressure. About 1 in 6 have high blood pressure or hypertension, and 1 out of every 3 aren't even aware they've got this serious medical condition. You want to have less than 140/90 at all times. Number 2, waist size and fat tissue percent. Let me explain. Your waist size, by the way, which is not where your belt sits, but it's above your hips and it's just below your ribs. If it's more than 35 inches as a woman or 40 inches as a man, your risk of dying prematurely is nearly double. Get accurately checked for fat percent as well using something called an impedance analysis. I don't want you to overly rely on BMI or body mass indexes. Sometimes it's a little inaccurate. Lastly, number 3, get updated blood work. Get checked regularly for cholesterol, fasting sugar as well, and something called C-reactive protein or CRP. Together, these give you a good risk assessment of your current health levels and inflammation in your bloodstream. If all of these are even slightly high, along with a slightly elevated blood pressure, you may be at risk for diabetes, whether it runs in your family or not. As far as natural health products go, the good news? Beta-cytosterol, found and synthesized exclusively by plants, such as in fruits, vegetables, soybeans, and peanuts, has demonstrated that supplementation of it into the diet decreases total serum cholesterol, as well as low-density lipoprotein, the LDL cholesterol, which is the bad cholesterol and may be of benefit for people with high levels of total blood cholesterol. Niacin, otherwise known as B3 vitamin, is a well-accepted and effective natural health product for the treatment of high cholesterol. Multiple studies show that for high cholesterol, niacin or B3 has significant benefits on levels of the good or HDL form of cholesterol, with better results, in fact, than prescription medications such as the statins in some cases. Many studies have also reported reductions in total blood cholesterol or bad cholesterol over short periods of time, about 4 to 12 weeks, with the use of garlic. Also, preliminary human studies suggest that cynarin and artichoke extracts may as well have lipid-lowering effects. There's a lot of good in natural health products for both your heart and your overall health.